After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press *1 on your telephone. If you require any further assistance, please press *0. I would now like to hand the conference over to Andrea Anneman from the Minnesota Department of Health. Thank you. Please go ahead.
Thank you, and thank you all for joining us for today's COVID-19 media briefing. On today's call, we have MDH Infectious Disease Director Chris Erzman, State Epidemiologist and MDH Medical Director Dr. Ruth Linfield, and Senior Lecturer at the University of Minnesota School of Public Health, Jonathan P. Leiter. After some updates from our speakers, we will open it up to questions from reporters on the line. So with that, I will turn it over to Chris Erzman.
Thank you, Andrea. Just to give you the global and national updates, as of this morning, there were 129 million cases occurring globally, up 705,000 from yesterday, and over 2.81 million deaths worldwide, an increase of 11,900 deaths. In the U.S., as of this morning, there were 30.4 million cases, up 66,800 from yesterday, and 552,000 deaths in the U.S., an increase of 1,075. In Minnesota today, we reported 2,140 cases for a new total of 521,667 cases since the start of the pandemic. That 2,140 new cases came on a volume of 43,117 lab tests. Both cases and test volumes are relatively similar to those reported 6 days ago. The 7-day average testing positivity rate is 5.4%. That is up, unfortunately, from 5.3 yesterday and remains in the caution range. The weekly change in cases is 2.2, up from 1.8% the week prior. And the weekly change in testing is 2.7%, so stable at 2.7%. We had 12 COVID-19 deaths reported today and have had a total of 6,860 deaths since the start of the pandemic. We have 435 Minnesotans in Minnesota hospitals with COVID-19. Of those, 105 are in intensive care. Over the course of the pandemic, there have been a total of 27,404 patients hospitalized and 5,635 received intensive care. In terms of the updates related to vaccine administration, almost 2.67 million total vaccine doses have been administered to Minnesota, as shown on our dashboard. That includes first and second doses. The number of people with at least one vaccine dose is almost 1.68 million. And the number of people who have completed a series of COVID vaccinations is over 1.5 million. I want to give you an update on some long-term care issues. Due to the real impact we are seeing with high vaccination rates and the impact that they have had on the spread of disease and serious illness, we have updated our guidance for assisted living type facilities to allow for more open dining and activities to better meet the needs of residents, families, and providers. The guidance for assisted living type facilities will allow residents who are fully vaccinated to dine and participate in activities closer than 6 feet while still wearing masks as appropriate. We made the change due to lower numbers of COVID-19 cases in assisted living facilities and the higher vaccination rates of residents. This guidance does not include Minnesota's skilled nursing facilities or nursing homes that serve a higher risk population. These facilities must follow federal guidance set by the Centers for Medicare and Medicaid. Highlights of the guidance change for assisted living type facilities. People who are fully vaccinated can gather indoors to play cards or sit in the dining room. For example, with people living in another unit or household within the assisted living setting. People who are fully vaccinated can gather informally with other unit or households of people who are unvaccinated or who disclose vaccination status if everyone follows guidance to reduce the spread of COVID. Fully vaccinated people can sit closer than 6 feet apart during organized activities and dining in the assisted living setting. We recommend that each person wears a well-fitting mask when gathering closer than 6 feet, except when eating. As a reminder, people are considered fully vaccinated for COVID-19 2 weeks after their final dose of vaccine. The updated guidance is available at the MDH website. Additionally, we wanted to share that CDC released new guidance for skilled nursing facilities this week on infection control and quarantine for residents who leave the facility. We are making modifications to our existing and just recently updated outings guidance to reflect what CDC now allows. We will post that update today or tomorrow. The key difference is that in most circumstances, residents of nursing homes and assisted living, regardless of their vaccination status, can leave the facility for less than 24 hours without having to quarantine when they come back, as long as they were not in close contact with someone who has COVID-19. The change will be effective immediately and means that residents in most circumstances can go out to be with family or friends for occasions like Easter without needing to worry about quarantining, if they go back to the facility later that day and if they have followed infection control practices. Then I just wanted to provide an update on the Johnson & Johnson vaccine. There was news yesterday that about 15 million doses of Johnson & Johnson vaccine were ruined at a manufacturing facility in Baltimore. Doses of Johnson & Johnson vaccine that are currently in use, and we're in contact with CDC and are evaluating what the impact may be to allocations of this vaccine going forward. At this point, it would seem that it will not affect Minnesota's doses, but we are waiting for final confirmation from CDC. And then I also wanted to comment on the good news of clinical trials for COVID-19 vaccine in children. As most of you probably already know, vaccine eligibility has expanded starting on Tuesday. Now, all Minnesotans age 16 and older are eligible for COVID-19 vaccines. We have still asked providers to prioritize people at high risk. There are 3 COVID-19 vaccines authorized for use right now. The Moderna vaccine and the Johnson & Johnson vaccine are authorized for people 18 and older. The only vaccine authorized for people age 16 and older is the Pfizer vaccine. So when we talk about eligibility for everyone age 16 and older, I just wanted to make sure it was clear that for people age 16 and 17, that still means that they should only be receiving the Pfizer vaccine. Currently, there are no COVID-19 vaccines authorized for children younger than 16. However, clinical trials are underway for both the Pfizer and Moderna vaccines to evaluate how they work in children. Initial data released by Pfizer this week, it has not undergone peer review yet, shows promising results for effectiveness in adolescents in their phase 3 clinical trials. Pfizer reported 100% efficacy for participants 12 to 15 years. We expect to hear more about these trials in the coming weeks, and we'll watch closely for data to be published and reviewed by FDA and CDC advisory groups. Our hope is that we'll be able to start vaccinating at least some younger age groups by fall. And then I wanted to highlight a real-world vaccination effectiveness study. CDC recently published a new study of real-world results among people vaccinated in several communities around the country, including Duluth, Minnesota. The study monitored nearly 4,000 healthcare personnel, first responders, and other essential and frontline workers who had been vaccinated. Under these real-world conditions, the messenger RNA vaccines from Pfizer and Moderna, the effectiveness of full immunization was 90% against both asymptomatic and symptomatic COVID-19 disease. This is very high and nearly as strong as the 95% figures from the clinical trials. and the study reinforces the evidence that these vaccines are both safe and effective at defeating COVID-19. The findings expand upon other reports by demonstrating that the vaccines can also reduce the risk for infection, regardless of whether the person has symptoms or not. The Johnson & Johnson vaccine had not been authorized by the FDA at the time of this study, but we look forward to getting more data on real-world effectiveness of that vaccine as well. All of the vaccines currently available are safe and effective, and we encourage Minnesotans to get whatever vaccine is available to them. And with that, I'll turn it over to Dr. Ruth Linfield for an update on variants.
Thank you very much, Director Erzman. I'd like to provide an update on variants of the virus that cause COVID-19. The Minnesota Public Health Laboratory is now sequencing about 350 samples a week, and the University of Minnesota Genomics Center is sequencing about 250 samples a week. Sequencing capacity from Minnesota samples is increasing. We are continuing to see spread of a number of variants of SARS-CoV-2. These variants are of concern because they appear to be more contagious, and in some cases, they are associated with more severe disease. Some of these variants, other than B117, in the laboratory appear not to respond to certain monoclonal therapies, and antibodies from people who received vaccine or had prior infection may not neutralize these strains as well as other strains. To remind you, much of our sequencing is targeted and not random, including samples from cases associated with clusters or samples that we suspect are B117 because of the reaction on a particular laboratory test known as the S-gene dropout, or samples from people with recent international travel. CDC has partnerships with commercial laboratories who are sequencing some samples from Minnesota. To date, in Minnesota, there have been 943 B117 cases identified. This is the variant that was first identified in the UK. This variant is about 50% more contagious and has been associated with a 64% higher death rate in the UK compared to other strains. B117 cases identified. This is the variant that was first identified in the UK. This variant is about 50% more contagious and has been associated with a 64% higher death rate in the UK compared to other strains. In Minnesota, only 12%
Absolutely.